Topic for today's discussion is permanent first molars. Myself, Dr. SHARLENE SARA BABU, Additional Professor, Department of Oral and Maxillofacial Pathology, Pusphagiri College of Dental Sciences. Moving to the introduction of permanent first molars, there are 6 molars in each arch and 3 in each quadrant. The molars are the largest and the strongest teeth because of the greater crown bulk and the excellent anchorage of their multiple roots. The maxillary molars have the 3 roots, whereas the mandibular molars have 2 roots. Permanent first molars are called as 6-year molars as they erupt at about 6 years of age. Third molars are present only in the permanent dentition and are referred to as wisdom teeth. They are the last teeth to erupt into the oral cavity at around 18 to 21 years of age. Molars develop from 4 or 5 lobes. The mesial and the distal contact areas are broader and are at the same level. Molars have widest occlusal tables and are the main teeth used for trituration and comminution of food. They give support to the teeth. Let's move to permanent maxillary first molar. It is the largest tooth in the maxillary arch. They develop from 5 lobes and has a large crown and 3 well-formed roots. It has 4 well-developed cusps and a small supplemental cusp. The 4 cusps are the mesiobuccal, distobuccal, mesiolingual and the distolingual cusp. The small non-functional cusp found lingual to the mesial cusp is called the cusp or tubercle of Carabelli or simply as a 5th cusp. The 3 roots are mesiobuccal, distobuccal and palatal or lingual, and this lingual root is the longest among the 3 roots. About the chronology, the first evidence of calcification is at birth, enamel completion at 2.5 to 3 years, eruption 6 to 7 years, and root completion 9 to 10 years. You should look in detail on the measurements. I'm not going into the measurement details. After measurements, you are supposed to write the tooth notations also. That is, first the universal notation, next the FDI notation, Zsigmondy-Palmer notation, and the Victor-Hadwer notation. Let's go in detail on the crown and now the buccal aspect. The geometrical shape is trapezoidal. First, let us go on the crown detail. The first is a mesial outline. It is straight and becomes slightly convex as it joins the occlusal outline, and the mesial contact area is at the occlusal third of the crown. The next is a distal outline. It is a more convex arc from the cervix up to the point where it joins the occlusal outline, and the distal contact area is at the middle third of the crown. Next is the occlusal outline. It is formed by the mesiobuccal cusp and the distobuccal cusp and their cusp slopes. The buccal developmental groove is seen between the mesiobuccal cusp and the distobuccal cusp. Next, about the cervical outline, it is irregular and curves slightly in apical direction. Next is the buccal surface within the outlines. All the cusps are visible from this aspect, and some portion of the distal surface can also be seen. The mesiobuccal cusp is wider and longer than the distobuccal cusp, and the buccal developmental groove separating the buccal cusp run half the length of the buccal surface and ends in a buccal pit. The buccal surface is more convex in the cervical third, slightly convex or flattened in the middle third, and again convex in the occlusal third. Let's move to the palatal aspect. Again, the geometrical shape is trapezoidal. Going to the mesial outline, it is a straight course dropping down from the cervical area and joins the mesial slope of the mesiolingual cusp at right angle. The distal outline forms a semicircular arc by merging smoothly with the distolingual cusp. Occlusal outline, it is formed by the mesiolingual and the distolingual cusp tips and their cusp slopes. The lingual developmental groove is seen between the mesiolingual and the distolingual cusp. The cervical outline is nearly straight. Moving to the lingual surface within the outlines. Only the lingual cusp are seen from this aspect. Mesiolingual cusp is much larger than the distolingual cusp, which is smooth and spheroidal. The lingual developmental groove separates the lingual cusp and ends at the center of the lingual surface. The characteristic feature of the lingual surface is the presence of the cusp of Carabelli or the fifth cusp. The fifth cusp may be well developed into a large cusp or may show traces of its development in the form of grooves, depression or pits. A developmental depression begins just cervical to the lingual developmental groove and extends beyond the cervical line onto the lingual root to fade out at the middle third of the root. Next is a mesial aspect. The geometrical shape is trapezoidal. The buccal outline, it is convex in the cervical third and flatten out as it runs occlusally, and the height of contour is within the cervical third. Lingual outline, it is a more convex arc from the cervical line to the tip of the mesiolingual cusp, and the height of lingual contour is at the middle third of the crown. Next is occlusal outline. It is formed by the mesial marginal ridge along with the triangular ridges of the mesiobuccal cusp and the mesiolingual cusp. Next is a cervical outline. It curves occlusally by 1 mm. Moving to the mesial surface within the outlines, the mesiobuccal, mesiolingual and the fifth cusp are seen. The mesiolingual cusp tip is on line with the long axis of the lingual root. The mesiobuccal cusp tip is on line with the buccal outline of the mesiobuccal root. There is a concavity cervical to the mesial contact area, that is at the junction of the occlusal and the middle third, which may extend onto the cervical portion of the root trunk. Next, let us move to the distal aspect. The geometrical shape of the crown is trapezoidal. Going to the buccal outline, it is convex in the cervical third and flatten out as it runs occlusally, and some portion of the buccal surface can also be seen. Height of the buccal contour is within the cervical third. Lingual outline, it is a smoothly convex from cervical line to the tip of the distolingual cusp. The height of contour is at the middle third of the crown. Next is occlusal outline. The distal marginal ridge is shorter and at a lower level than the mesial marginal ridge. So, some part of the occlusal surface and the triangular ridges of the distal cusp may be seen. The cervical outline is nearly a straight line. Then about the distal surface within the outline, the distal surface is narrower than the mesial surface as the crown tapers towards a distal aspect. The distal surface is smoothly convex and the distal contact area is at the middle third of the crown. Let us move to the occlusal aspect. The geometrical shape is rhomboidal. The buccolingual measurement of the crown is greater than the mesiodistal diameter by 1 mm. And the crown tapers distally, that is, a crown is wider mesially than distally. The mesiodistal dimension of the crown lingually is greater than the mesiodistal dimension of the crown buccally. Let's move to the boundaries. The mesial and the distal cusp ridges of the four major cusps and the mesial marginal ridge and the distal marginal ridge constitutes the boundary of the occlusal aspect. And the occlusal surface within the boundaries exhibit the cusp and the cusp ridges, the grooves and the pips, the fossae and the marginal ridges. Let's move in detail on the cusp and the cusp ridges. The four major cusps and a supplemental cusp, that is a cusp of Carabelli, may or may not be well developed. The four major cusps are the mesiobuccal cusp, distobuccal, mesiolingual and the distolingual, and the fifth cusp is the cusp of Carabelli, that is a supplemental cusp. The cusp in the decreasing order of size are the mesiolingual cusp is the largest, followed by mesiobuccal cusp, distobuccal cusp, distolingual cusp and the fifth cusp. And each cusp has mesial and the distal cusp ridges and a triangular ridge of its own sloping towards the center of the occlusal surface. And there are inclined planes on either side of the triangular ridge. And there is an additional ridge crossing the occlusal surface obliquely, and that is known as the oblique ridge. Oblique ridge is formed by the union of the triangular ridge of the distobuccal cusp and the distal ridge of the mesiolingual cusp. And it is at the same level as the marginal ridges, and it is crossed by a developmental groove, that is a transverse groove of oblique ridge. Next, let us go in detail on the grooves and the pits. The first is a buccal developmental groove. It runs buccally from the central pit located in the central fossa and continues on to the buccal surface of the crown, separating the mesiobuccal and the distobuccal cusp. The next is a central developmental groove. It runs in a mesial direction from the central pit and ends at the apex of the mesial triangular fossa. Next is a transverse groove of oblique ridge. It runs in a distolingual direction from the central pit and crosses the oblique ridge to reach the distal fossa. The next is a distal oblique groove. It is an irregular groove and radiates from the distal triangular fossa and runs obliquely to join the lingual developmental groove. Next is a lingual developmental groove. The distal oblique groove joins the lingual developmental groove at the junction of the cusp ridges of the mesiolingual and the distolingual cusp and runs on to the lingual surface, separating the mesiolingual and the distolingual cusp. The next is a Stewart groove. It is a small groove which extends from the central groove to separate the two portions of the triangular ridges of the mesiolingual cusp. Next is a fifth cusp groove. It separates the fifth cusp from the mesiolingual cusp. Next, the multiple supplementary grooves. There are several supplementary grooves, especially at the apexes of the mesial and the distal triangular fossa, and some may cross the marginal ridges. Next, about the pits. Here comes the central pit, and it is a pinpoint depression in the central fossa, and three major developmental grooves originate from this central pit. They are the buccal developmental groove, central developmental groove and the transverse groove of oblique ridge. The next is a mesial pit. It is at the apex of the mesial triangular fossa and the central developmental groove terminates at this pit. The next is a distal pit. It is at the apex of the distal triangular fossa and the distal oblique groove ends in this pit. Next, about the fossae. There are two major fossae, that is a central fossa and the distal fossa. And there are two minor fossa, that is a mesial triangular fossa and the distal triangular fossa. The central fossa, it is a large triangular depression in the center of the occlusal surface mesial to the oblique ridge. The boundaries are the distal slope of the mesiobuccal cusp, the mesial slope of the distobuccal cusp, the crest of the oblique ridge, and the crest of the triangular ridges of the mesiobuccal and the mesiolingual cusp. It has a central pit at its center and three major developmental grooves run across it. Next is the distal fossa. It is a small linear developmental depression distal to the oblique ridge. It comes here. It has a distal oblique developmental groove at its deepest position. Next, going to the minor fossa. Which are the minor fossas? The mesial triangular fossa, and the distal triangular fossa. The mesial triangular fossa is a triangular depression having the mesial marginal ridge at its base and the mesial pit at its apex. The distal triangular fossa has a distal marginal ridge at its base and distal pit at its apex. Next, going to the marginal ridges. They are the mesial marginal ridge and the distal marginal ridge. They are well developed and the distal marginal ridge is shorter and at a lower level than the mesial marginal ridge. Let us move about the root. It has three well developed root, that is a mesiobuccal, distobuccal and the palatal roots. The roots are about twice the length of the crown. The palatal root is the longest and the largest. The mesiobuccal and the distobuccal root are of nearly of same length and the mesiobuccal root is larger than the distobuccal root. All three roots have a bluntly rounded apices. There will be 3 or 4 root canals, that is a mesiobuccal, distobuccal and the palatal, and sometimes an accessory canal is noted in the mesiobuccal root. And how do you identify this permanent maxillary first molar? The tooth has a large crown and 3 roots. The crown is wider buccolingually than mesiodistally. The occlusal aspect is rhomboidal. The unique feature is a cusp of Carabelli present lingual to the mesiolingual cusp, and the characteristic feature is the oblique ridge. And once you identify the particular tooth as maxillary first molar, you have to identify whether it is a right or left. So, how to do the side identification? When viewed occlusally, the crown is wider mesially than distally. By locating the cusp of Carabelli, which is present lingual to the mesiolingual cusp, then the buccal root may tend to have a distal inclination. If you have time to write, you can add these points also. What all developmental anomalies can be expected in this permanent maxillary first molar? There can be supernumerary root. What is supernumerary root? That is more than 3 roots. Normally, maxillary first molar has 3 roots. If the number of the root is more than 3, then the tooth will be having supernumerary roots. The second is a dilaceration of the root. That is, one or more of the root may have a sharp bend. Then that is known as dilaceration. The third is concrescence. That is, union of the cementum, that is adjacent tooth, will be joined by cementum, that is known as concrescence. And that's it about permanent maxillary first molar morphology. And this primary cusp triangle is a very important short note. From the developmental point of view, the maxillary molars have only three primary cusps, that is mesiobuccal, distobuccal and mesiolingual. And the distolingual cusp become progressively smaller on the second and third molars. A triangular outline can be visualized by tracking the cusp ridges of three primary cusps, the mesial marginal ridge and the oblique ridge. These three primary cusps can be seated on the root trunk divided into three roots. This triangular arrangement of the three primary cusps is a characteristic of all maxillary molars and is called as the maxillary molar primary cusp triangle. The design of the maxillary molar primary cusp triangle become progressively more evident from first molar to third molar. Let's move to permanent mandibular first molar. Introduction. The mandibular first molar is the largest tooth in the mandibular arch. The mesio-distal dimension of the crown is larger than the buccal dimension by about 1 mm. It has 5 cusps, 2 buccal, that is a mesiobuccal, distobuccal, 2 lingual, mesiolingual, distolingual, and a distal cusp. And it has 2 root, that is a mesial and the distal root. Moving to the chronology, the first evidence of calcification is at birth. Enamel completion 2.5 to 3 years, eruption 6 to 7 years, and root completion 9 to 10 years. You have to look into the measurement part. Next, you are supposed to write on the tooth notations, that is universal notation, FDI notation, Sigmondi-Palmer notation, and the Victor-Hadwer notation. Let us start discussing on the crown. The first, buccal aspect. The geometrical shape is trapezoidal. The mesial outline, it is convex except near the cervical line where it is concave. The mesial contact area is at the junction of the occlusal and middle third of the crown. The distal outline, it begins as a straight line near the cervix and soon becomes convex, forming the distal contact area is at the middle third of the crown. Occlusal outline, it is formed by the mesiobuccal cusp, distobuccal cusp and a small distal cusp. The mesiobuccal developmental groove separates the mesiobuccal cusp and the distobuccal cusp, and the distobuccal developmental groove separates the distobuccal cusp and the distal cusp. The cervical outline, it curves in an apical direction. Next, the buccal surface within the outline. All the 5 cusps are visible from this aspect. The lingual cusp are seen in the background as they are at higher level than the buccal cusp. The mesiobuccal cusp is wider than the distobuccal cusp. The mesial and the distal cusp ridges of the 2 buccal cusps are relatively flat. The mesiobuccal cusp and the distobuccal cusp are separated by mesiobuccal developmental groove which run for half the distance of the buccal surface and ends in a buccal pit. The distobuccal cusp and the distal cusp is separated by the distobuccal developmental groove which run for half the distance of the buccal surface and may or may not end in a lingual pit. The buccal surface is convex in the occlusal third except for the interruption by the buccal grooves, then a linear concavity in the middle third of the crown and more convex in the cervical third, forming the buccal cervical ridge. Next, about the lingual aspect. Again, the geometrical shape is trapezoidal. The mesial outline is convex except near the cervical line where it is concave. Mesial contact area is at the junction of the occlusal and middle third. The distal outline, it begins as a straight line near the cervix and soon becomes convex, forming the distal contact area which is at the middle third of the crown. The occlusal outline is formed by the sharp cusp tips of the mesiolingual and the distolingual cusp and their cusp ridges. The lingual developmental groove separates the mesiolingual cusp and the distolingual cusp. The cervical outline is irregular and may bend apically. Next, the lingual surface within the outline. Only the lingual cusp and a small part of the distal cusp are visible from this aspect. The mesiolingual cusp and the distolingual cusp are almost of same width and are sharper and longer than the buccal cusp. The mesiolingual cusp tip is at a higher level than the distolingual cusp tip. The distal cusp tip is at a much lower level. The lingual developmental groove separating the mesiolingual and the distolingual cusp runs for a shorter distance on the lingual surface and is in line with the root bifurcation. The lingual surface is smoothly convex in the occlusal portion and becomes flat in the cervical third. There is a shallow concavity in the center of the lingual surface of the middle third. Moving to the mesial aspect, the geometrical shape is rhomboidal. The buccal outline, it is convex in the cervical third at the buccal ridge, and from there it is slightly convex up to the flat-ended mesiobuccal cusp tip. The height of buccal contour is at the cervical third. Lingual outline, it is evenly convex from cervical line to the mesiolingual cusp tip, and the height of lingual contour is at the middle third of the crown. About the occlusal outline, it shows a sharp mesiolingual cusp tip at a higher level than the flat-ended mesiobuccal cusp tip. The mesial marginal ridge forms a concave outline and merges with the mesiobuccal and mesiolingual cusp. About the cervical outline, it may be straight or curved occlusally. Then the mesial surface within the outline. The mesiobuccal and the mesiolingual cusp are seen. The mesiobuccal and the mesiolingual cusp are within the confines of the root base. The mesial surface is smoothly convex except for a shallow concavity just below the mesial contact area which joins a central depression on the mesial surface of the mesial root. Mesial contact area is at the junction of the occlusal and middle third of the crown. Moving to the distal aspect, the geometrical shape is rhomboidal. The buccal outline, it is convex in the cervical third at the buccal cervical ridge, and from there it is slightly convex up to the flattened mesiobuccal cusp tip. The height of buccal contour is in the cervical third. The lingual outline, it is evenly convex from cervical line to the tip of the mesiolingual cusp. The height of lingual contour is at the middle third of the crown. Now the occlusal outline. The distal marginal ridge is shorter and at a lower level than the mesial marginal ridge. Therefore, more of the tooth, that is all the 5 cusps, are visible from the distal aspect. About the cervical outline, it may be straight. Next, about the distal surface within the outline. The distal surface is shorter and narrower than the mesial surface, and most of the buccal surface and some portion of the lingual surface may be seen from this aspect as a crown tapers distally. The distolingual and the distal cusp, are in direct line of view. Most of the distobuccal cusp is also seen along with the distobuccal groove. Most of the occlusal surface Along with the mesial marginal ridge is visible, the distal surface is smoothly convex and the distal contact area is in the middle third of the. Moving to the last, that is occlusal aspect, the geometrical shape is hexagonal. The mesio-distal dimension of the crown is greater than the buccolingual dimension. The crown tapers distally towards a small distal cusp, that is, the crown is wider mesially than distally. The mesial and the distal surfaces converge lingually, that is, the lingual surface of the crown is narrower than the buccal surface. About the boundaries. The boundary is constituted by the mesial and distal cusp ridges of the ficus and the mesial and the distal marginal ridges. Next is occlusal surface within the boundaries that include cusp and cusp ridges, grooves and the pits, fossae and the marginal ridges. In detail on the cusp and the cusp ridges. There are 4 major cusps and one minor cusp. The cusp in the decreasing order of the size are the mesiobuccal cusp, mesiolingual cusp, distolingual cusp, distobuccal cusp, and the distal cusp. The cusp ridges of the buccal cusp and the distal cusp are usually flattened. The lingual cusps are sharp with well-defined cusp ridges. Each cusp has mesial and distal cusp ridges and a triangular ridge of its own sloping towards the occlusal surface, and there are inclined planes on either side of each triangle. Next, about the fossae. There are 3 fossae, one major fossae, that is a central fossae, and 2 minor fossae, the mesial triangular fossa and the distal triangular fossa. Let's go in detail on the central fossa. They are large circular or roughly triangular depression in the center of the occlusal aspect, and it has a pit at its center. It is bounded by the distal slope of the mesiobuccal cusp, mesial and distal slope of the distobuccal cusp, distal slope of the mesiolingual cusp, and the mesial slope of the distolingual cusp. The mesial and the distal triangular fossae have mesial and the distal marginal ridges at its base and the mesial pit and the distal pit at its apex. Next, moving to the marginal ridges. This is a mesial marginal ridge and this is a distal marginal ridge, and the distal marginal ridge is shorter and at a lower level than the well-developed mesial marginal ridge. Next, about the grooves and the pits. There are 4 developmental grooves and some supplemental grooves on the occlusal surface. The first is a mesiobuccal developmental groove, distobuccal developmental groove, central developmental groove, and the lingual developmental groove. And there are 3 or sometimes 4 pits. That is a central pit, mesial pit, distal pit, buccal pit. Lingual pit may or may not be present. Now let us see about the central developmental groove. It originates at the central pit and runs in a mesial and distal direction to end in the mesial triangular fossa and the distal triangular fossa. The next is the mesiobuccal developmental groove. It starts from the central pit and runs buccally, separating the mesiobuccal and the distobuccal cusp and ends on the buccal surface, halfway on the buccal surface, and ends in a buccal pit. The next is a distobuccal developmental groove. From the central pit, it runs distobuccally between the distobuccal cusp and the distal cusp and ends on the buccal surface. That may or may not end in a pit, but mostly there won't be a pit. The next is a lingual developmental groove. It takes a long course from the central pit and extends onto the lingual surface, separating the mesiolingual and the distolingual cusp, and may end in a lingual pit. And several supplemental grooves can be seen originating from the developmental group. Then about the root, it has two well-developed roots, that is a mesial root and the distal root. The roots are nearly twice as long as the crown and both the roots are of same length. There are developmental depressions on the mesial and the distal surface of both the roots extending for the entire length. The mesial root has a blunt apex and the distal root has a relatively sharp apex. The pulp, about the pulp canals, the mesial root may have two canals and the distal root has one canal. Next, about the developmental anomalies, they are the dilacerations, concrescence and taurodontism. Dilaceration, I have already told you, that's a sharp bend in the root. Concrescence, adjacent teeth are joined by cementum, and the last taurodontism, that is a bull-like teeth. And how can you identify this particular tooth? It has 5 cusps and 2 well-formed roots. Distal cusp is smallest and helps to identify the tooth and its side. And about the side identification, the smallest cusp, that is a distal cusp, help in identifying the side, and the root often show a distal curvature. And last, the questions frequently asked. Essay, discuss in detail on permanent maxillary first molar and add a note on the tooth notations and chronology. Question number 2, discuss in detail on permanent mandibular first molar and add a note on tooth notations and chronology. Next, the short notes. Occlusal aspect of maxillary first molar, occlusal aspect of mandibular first molar, primary cusp triangle and oblique ridge.